Working for you. CBS 6 News at 5:30 starts now.
Babies in the city. A new study says babies growing up in downtown Richmond won't live as long as ones a few miles away, and researchers point to 3 reasons why. Thanks for joining us at 5:30. I'm Rob Desir.
And I'm Julie Bragg. The study was done at VCU, and it found you could live 20 years longer depending on what part of Richmond you're in. Shelby Brown is working for you on how they came up with the numbers. Shelby?
Well, Julie and Rob, VCU researchers use grant money to create what they call a life expectancy map. They tell us that they use census data from the Virginia Department of Health, but the folks we spoke with today here in the city of Richmond called that study eye-opening. Jessica Jones longs for the day she doesn't have to hop on a bus with her children to travel across town just to get to the grocery store. She's not alone.
More fresh fruit and fresh vegetables for my kids to eat.
For example, the new Walmart that opened up downtown in VCU this morning, that could be a very good beginning, you know what I mean? So maybe some of the larger chains could maybe, consolidate a smaller style store, maybe within the 5 or 10 mile radius of the inner city. You know what I mean? So people can have access to more things. VCU researchers focused on Jessica's Gilpin neighborhood, among others, compiling data to form this life expectancy map. It shows that babies born within 5 miles of downtown Richmond face up to a 20-year difference in life expectancy. There are only 5.5 miles between Jessica's Gilpin neighborhood and this Westover Hills community. Dr. Derek Chapman explains that several factors influence the 20-year difference, like education, jobs, safe and affordable housing, nutritious food, and places for physical activity.
The neighborhood can influence your ability to exercise based on availability of sidewalks and parks, having, again, the financial means to pay for gym memberships, or even having a neighborhood that's safe enough to be out and walking about.
We need to have more doctor's offices in this area. We need to have grocery stores in this area instead of corner stores. So I think if we had that, I think that might help a little bit.
Chapman says the goal is to highlight the stark differences in health outcomes across small areas and to draw city and community leaders to the table to find solutions to bridge this life expectancy gap. Now, that grant money not only allowed researchers to focus on the city of Richmond, but they also created those life expectancy maps for Atlanta, New York, Chicago, as well as 16 other cities across the U.S. For now, working for you in Richmond, Shelby Brown, CBS 6 News.